Welcome, everyone. Thanks for your interest in longitudinal study of aging in India. I'm one of the 3 PIs of the LASI project. And this project is a collaborative effort by Harvard School of Public Health, International Institute for Population Sciences based in Mumbai, and our team at University of Southern California. We are very happy to be here introducing our data for the larger research community. We developed the LASI study with the goal of developing a nationally representative longitudinal survey of aging, health, and retirement in India. We envisioned this data would provide the foundations for innovative multidisciplinary studies of aging for both policymaking and scientific advances. As we develop our study to be compatible with other population studies, such as HRS and other HRS international network of studies, this data will enable many of you to engage in conducting cross-country analysis. So today we aim to provide some basic information about our data so you can jump up and utilize the data as we move along. Thank you.
Thanks, Jungkook. And this is a webinar, so we do encourage your participation. We have our webinar today divided into kind of 3 slots. We'll give an introduction to LASI by Jungkook, and that'll be through a video that's pre-recorded. And then we also have a video about kind of the structure of the LASI data that's really helpful for getting started. And then we'll have some slides on the financial variables inside of the LASI data. So if you have questions, you can ask them in the question and answer portion of the Zoom webinar, and we can answer them when we get to you. And we'll also have a question and answer portion at the end. And this webinar will be recorded, so you'll be able to access the slides and a recording after this. So let's get started with our first video from Jungkook.
It is my great pleasure to join the baseline wave of LASI dissemination webinar. I'm Jungkook Lee, a professor of economics at the University of Southern California and one of the PIs of the LASI. This is a fruit of my colleagues at IIPS, Harvard, and University of Southern California's significant and diligent efforts over 10 years. I'm going to briefly go over the methodology we employed in this talk. I'd like to start with the key aspects of research design, which shaped our sample and instrument. LASI is a nationally representative panel study. To enable the study of longitudinal changes and birth cohort differences, we adopted a steady-state design, not only following our sample over time, but also bringing in new age-eligible sample in every wave, so we can compare aging processes for those who were age 45 and older in 2017 and the same age group in 2021. For successful maintenance of panel study without an excessive budget, we adopted a clustered sample design. We targeted older adults aged 45 and older and their spouses regardless of their age, and this age threshold of 45 is selected to enable us to study the changes in labor force participation well before one retires. Considering significant cross-state variations in policies, we aim to achieve not only national level representation, but also state level representation, and sampling strategy is developed accordingly. One of the key distinguishing features of LASI is its multidisciplinary nature, covering the topics ranging from demographics to health and cognition, economic and social aspects as well. We try to bring several important innovations, integrating biomarkers into social survey. Biological markers provide objective measures without self-report biases, We provide high-quality economic data, including not only consumption, but also income, asset, and debts, based on the latest advances in survey and economic literature. Finally, we use the computer-assisted personal interview for data collection, which established us real-time data monitoring and supervision. Now, let me briefly go over our sampling strategy, a multi-stage stratified area probability cluster design. As we aim to draw a sample representative of each state and union territories, we first stratify all subdistricts within each state and union territories according to geographic regions, then within each region according to subdistricts population size, proportion of scheduled caste and tribe population, and the proportion of males in non-agricultural sector. We selected the primary sampling units from each stratum, and then from each PSU, we chose 5 secondary sampling units from each PSU. The sampling frame for these SSU were villages in rural areas and census numeration blocks in urban wards from 2011 census. Since there is no readily available sampling frame for households in India, we carried out a mapping and household listing exercises. This means that we sent a field team to all selected SSUs and identified all households in the selected villages and census numeration blocks. Population-wise, India is a still young country, with older population proportionately small in numbers. Therefore, in order to ensure large enough sample for older population, we oversampled those ages 65 years and older. With this oversampling, about one-third of our sample is ages 65 and older. We also oversampled 4 metropolitan cities to provide city-specific estimates. In determining sample size, we consider the sample required for accurate estimation of disease prevalence. The sample size of 1,000 for each state seems to be the minimum necessary sample size for reliable estimate of disease prevalence, so we targeted 1,000 age-eligible sample for the smallest states and union territories. For a state with larger populations, larger geographic spreads, and more heterogeneity in socioeconomic status, we recruited larger sample to ensure sample representation. For example, we have a sample of 4,000 for Uttar Pradesh and 2,000 for Tamil Nadu, excluding Chennai, and Chennai itself has 1,000 sample. Here you can see a diagram of our survey protocol. After mapping and listing, we randomly selected households for potential LASI interview. But without an interview, we do not know whether selected household would include anyone age 45 years or older. Therefore, all selected households, we collected household roster information, identifying all household members' age, gender, and other basic demographic information. Here, the households with age qualifying persons are then considered as LASI household, and the household without age qualifying person were not selected for interview, but information is kept for drawing refresher sample for follow-up wave. Through cover screen interview, we also identify who is most knowledgeable about household finances so we can administer household interview. Note here, we collect household level information only once by interviewing most knowledgeable person, and the informant who answered questions on income and wealth could be, and in fact, often differ from the informant who answered questions related to housing. From cover screen, we also identify spouses of all age qualifying others, and based on this information, we conduct individual interviews with all others age 45 and above and their spouses, regardless of age. All individuals who were selected. Individual interviews were also asked to participate biomarker collection. Finally, we also conducted a separate community survey for all selected SSUs, which I will discuss next. This slide summarizes the key survey contents. For household interview, we collect information on housing characteristics. We also collect information about consumption, assets and debts, household income, and insurance holdings and coverages. For individual interview, we start with detailed demographic information, current work for those who are in the labor force, and past work for those who are no longer in labor force, their retirement and pension, post receipts and eligibility. We administer the comprehensive health module, including both chronic and infectious diseases, functional health, cognition, health behaviors, and healthcare utilization, as well as family medical history. We collected information about family members' demographics, their interaction with visiting them, communicating with them, and the support they provide. And finally, we have experimental modules to bring innovative new contents. Each respondent was asked to answer one of these experimental modules, so you will see a quarter of respondents answered each of these 4 modules. Our rich biomarkers include anthropometrics, blood pressure and pulse, several performance measures like timed walk, grip strength, and vision test. We are currently conducting DBS assays, and once assay work is complete, we plan to release those data as well, together with spirometry data. Finally, we collected the community level information by interviewing knowledgeable persons at the community like government personnel, collecting information about infrastructure available in the community and history of environmental shocks and the prices of ration goods. Our instrument was developed separately for rural and urban areas, given significant differences between urban and rural areas. This diagram illustrates how we implemented the data collection supervision and how we monitor the data as they come in. Our LASI team, including collaborators at IIPS, Harvard, and USC, developed the project protocol. Then core LASI team at IIPS played a pivotal role in interviewer training and project management. Training and management were organized first at national level with the state team, and then each state team organized the fieldwork for their own state. The national level training was done in English, and then all state level training was done in local languages. Regional geriatric center support was critical in collecting health and biomarker data. One of the main advantages of conducting computer-assisted personal interview is to be able to monitor the data in real time. As the fieldwork unfolds, we asked each local team to upload the data to server regularly, at least once a week, and we were able to monitor the progress of fieldwork and examine the distribution as data come in. We diligently monitored the data, and when unusual patterns were observed, such as interview administration time took too long or too short, inconsistent, unrealistic responses were recorded, we then went back to the respondents and sorted out particular cases. For sure, magnitude and complexity of work required careful planning and implementation. We unfolded the fieldwork in 3 phases from April 2017 till November 2019, although most of data collection were done in 2017 and 2018. We achieved excellent response rates despite that it was a lengthy interview, taking about 2 hours for an individual interview, including biomarker collection, and slightly less than an hour for a household interview. So for a household with two eligible respondents, the entire interview would take about 5 hours. Now I invite all of you to explore our rich data. You can obtain LASI data by applying for data access at IIPS website as well as USC website shown here. This is an opportune time for aging research in India. Let's get busy. Thank you for your interest and attention. Hello, it is my great.
Hello everyone, my name is Hunter Green and I'm a research programmer with the Gateway to Global Aging Data. Today I will be speaking to you about the structure of the recently released LASI public use data, as well as how to access that data. 3 data files have been released and are currently available for download. The cover screen data file includes household rosters for all households that were randomly selected for potential LASI interview from the secondary sampling units. These household rosters contain basic demographic information for all household members such as age, gender, and education. The household data file includes information from households with at least one person aged 45 and older. Household information was gathered once per household from the most knowledgeable adult person aged 18 and above residing in the household. This data consists of 5 modules. The Housing and Environment module contains information related to the housing and environmental conditions of surveyed households, such as the number of bedrooms, source of drinking water, and household construction material. The Household Consumption module contains household expenditures, including detailed health expenditures and consumption of food and non-food items. The Household Assets and Debts module includes information about household financial and non-financial assets and debts. The Household Income module contains income for household members from labor and other sources, such as government transfers and remittances. The Household Health Insurance module contains household health insurance information, including type of health insurance, coverage, and premiums. The individual data file includes information from all age-eligible respondents aged 45 and above, and their spouses regardless of age. This data consists of 8 modules. The Demographics module contains detailed individual demographics such as place of birth, caste, education, marital status, and migration. The Work, Retirement, and Pension module contains information about employment status, wages, past work, job characteristics, job search, retirement, and pension benefits. The Health module contains a wide variety of information, including self-reported health status, chronic and endemic diseases, oral health, immunization history, childhood health, women's health, functional health, cognition, and health behaviors. The Family and Social Networks module contains information about the respondents' families, friends, and social networks, as well as available social support and involvement in social activities. The Social Welfare Schemes module contains information about social welfare coverage. The Experimental module contains information about time use, economic expectations, social connectedness, and vignettes. The Biomarker module contains information about anthropometrics, blood pressure, and performance measures, such as gait speed, grip strength, and balance. It is important to note that the current LASI release does not contain information about dried blood spot assays and lung function tests. The cover screen data file contains information about 65,584 households, of which 22,858 did not complete either the household interview or the individual interview. The household data file contains information about 42,951 households, of which 1,094 did not complete the individual interview. The individual data file contains information about 72,262 individuals. Of those, 6,363 individuals did not complete the biomarker module. In the cover screen, household, and individual data files, HHID uniquely identifies each household. Using this variable, it is possible to merge the 3 datasets together. In the individual data file, prime_key uniquely identifies each individual within a household. The LASI sample weights account for selection probabilities and adjust for non-response and post-stratification to accurately represent the population characteristics. Because LASI is both nationally representative and representative of each state and union territory, we have released two weights for each data file. The national level weights should be used to produce the nationally representative population estimates. These are CV_India weight for the cover screen data, India HH weight for the household data, and India individual weight for the individual data. The state level weights should be used to examine households and individuals within a particular state. These are CV_state weight for the cover screen data, state HH weight for the household data, and state individual weight for the individual data. LASI variables are indexed by module and serially by question number. The prefix for each variable is an abbreviated version of the module that contains the question. Examples of this are CV for the cover screen data, AD for the household assets and debts module of the household data, and HT for the health module of the individual data. We have already recoded respondents who refused or could not answer the questions to special missing codes. Gateway users have the option to download the LASI public use data files in Stata, SAS, SPSS, or R format. In Stata and SAS, these special missing codes are .d for don't know and .r for refused. In SPSS, these special missing codes are -4 for don't know and -18 for refused. R does not allow for the use of special missing codes. This slide shows examples of some economic variables available in the household data file. For example, the Housing and Environment module contains information about toilet facilities, water supply, and cooking fuel. The Household Consumption module contains information about consumption of food items, expenditure on non-food items, and household health expenditure. The Household Assets and Debts module contains information about current residents for both renters and homeowners, agricultural assets, personal loans, and debts. The Household Income module contains information about agricultural income, individual earnings, and household income from various sources, including government transfers. This slide shows examples of various economic variables available in the individual data file. For example, the Work, Retirement, and Pension module contains information about job characteristics, employment history, timing of retirement, and type of pension. And the Experimental module contains information about time use in the last 24 hours, expectations of work-limiting health problems, and self-reported pain. The LASI public use data files are currently available for download on the Gateway to Global Aging Data website. I will briefly walk you through how to access this data. The first step is to visit the Gateway website at g2aging.org and register for access if you have not already done so. The registration process is very quick. You are only asked to provide your name, email address, country, and institutional affiliation. Once you are logged into the Gateway, select the Downloads Data and Links page at the top of the website and click on the Program on Global Aging, Health, and Policy link in the LASI column. The next step is to download the LASI Data Use Agreement, which can be accessed by clicking on the Data Access Use Agreement link. You will be asked to review and sign the agreement. The agreement will also ask you to fill in your name, title, institution, address, telephone number, and email address. Please fill in the same email address that you used when registering for the Gateway website. Once you have filled out the Data Access Use Agreement, click on the Data Agreement Form link. This form will ask you to provide your affiliation type and affiliated institution or organization. Here is where you will upload your completed Data Access Use Agreement. The agreement must be submitted in PDF format or it will not be accepted. After submitting the Data Agreement form, you will see this page letting you know that your application is pending. Once your application is approved, you will receive an email confirmation from the Gateway team. The link in the email will take you back to the Downloads, Data, and Links page of the Gateway website. Clicking on the Program on Global Aging, Health, and Policy link in the LASI column will take you to the data. Here you are able to download the LASI public use data files. As I mentioned before, the data is available in Stata, SAS, SPSS, and R formats. The download will also contain the LASI Wave 1 questionnaire, a data user guide which contains much of the information you have heard here today, and a codebook that lists variable names, labels, and summary statistics for all variables. In addition to releasing these data files, we also plan to release a harmonized LASI dataset and codebook later this year. The harmonized LASI will consist of research-ready variables that are built to account for survey skip patterns. In addition, to allow for cross-national comparisons, variables will be defined as similarly as possible to our harmonized datasets for other studies in the Health and Retirement Study family of surveys, such as the HRS in the United States, SHARE in Europe and Israel, and ELSA in England. That brings me to the end of my presentation. Thank you for your attention.
So since we've talked a little bit about what's in the LASI and the data structure, I'm going to spend a little bit of time talking about one of those variables inside of the LASI data, and that is the financial variables. So the measurement of financial variables is essential if you want to understand the economic position of individuals and households, but it is inherently difficult. So some of those reasons might be that respondents may be reluctant to provide answers, and the respondents may also not know or be unsure of the answers. So for instance, a question of the current market value of a certain asset, like a piece of land or your primary residence, they might not know that, not be able to provide an exact value. So as a result, respondents choose not to provide direct answers to financial questions. That's usually done by them answering "don't know" to the question, or saying that they refuse to answer the question. When analyzing survey data, usually complete case analysis is the default method in statistical packages. This is also called list-wise deletion. And in complete case analysis, results are only going to be based on those observations with no missing values. So for instance, in this kind of small example data set here, we have the gender of a person, age, years of education, their marital status, labor force status, whether they own a home, and the value of that home if they own it. And if we were interested in perhaps calculating the average or the median level of assets in home ownership across this data set, using complete case analysis, we wouldn't be able to consider that first person. We could consider person 3 and 4 because they have a value. And if we assume that person 2 and 5, that value of the home is 0, we can still include person 2 and 5, but then we're still not including person 1. And the issue is that person 1 in our small example data set here might not be random for who is not able to respond. So complete case analysis in the presence of missing data can have serious implications. One of those is potential huge loss of information, so large standard errors and imprecise estimators. And this loss can be compounded, especially when using aggregate total financial values. So for instance, instead of just the value of a home, for instance, what if we were looking at the total wealth of an individual, and let's say it was made up of 10 components. If each of those components had just 5% missing, then that could lead to a total missing of 40% in the value. So it's a huge loss of information potentially. And it also potentially introduces biases. So missing values are more common among people who receive the income or own the asset. So by using only complete case analysis, we're underestimating population income or wealth. So as we saw in our example, it's very easy for someone to say, I don't have a house, and then they don't have to provide that value. But for people who do own a house, it's important that we're able to have that value assigned to them. We have a value assigned to them to include them in our estimation. And the way that we can kind of address this issue is through imputation. So imputation puts values in the place of missing values. You can see here in our example again, if this our small data set here was imputed, what that would mean is that a value would be assigned for person 1, And then here we say 200,000 rupees, and that would allow for person one to be considered inside of our analysis results. So there's different imputations methods that can be used to assign that value when missing. And these different imputation methods can be based on different models, explicit or implicit, and on different variations of the same model. And all of these choices are going to lead to different results or different values being assigned. Included in the LASI public release data, there's two different sets of imputed financial variables. One set is constructed by IIPS, and that was those variables were used in the LASI national report. And one set was constructed by our team at USC. I'm going to talk about both those sets. And I'm also going to talk about some of the ways that LASI inside of the survey helps to address this issue of missing values. And one is called unfolding bracket questions. So in the case that a respondent is not able to provide an exact financial value, the LASI survey includes unfolding bracket questions to help respondents provide more information about their financial values. So if we look at this example, the first question is, in the past 12 months, has your household produced any livestock or fishery products such as milk, wool, or eggs? Yes or no? If the person answers yes, they get asked what was the value of the livestock or fishery products. And if they're not able, if they say, when they get asked that value question, if they say, I don't know, or they refuse to answer, then they get asked unfolding bracket questions. And so these look like an example here. So the first question would be, does it amount to less than, more than, or about 20,000 rupees? If the person says about 20,000 rupees, that's really helpful information. They could also say more than 20,000 rupees. And if they do that, then they're going to get another question, because it's an unfolding bracket question, with a higher value. So does it amount to less, more than, or about 45,000 rupees? Let's say this person said that it's, again, more than 45,000 rupees. They don't know the exact value, but they know that it's more than that. And then they get asked, does it amount to less than or about 100,000 rupees? And this person could say, okay, I know it's less than 100,000 rupees. And then that gives us a range in which, for the imputation procedure, we know that that value lies between. So in this example we walked through, we think that the true value lies between 45,000 and 100,000 rupees. So we've really narrowed that possible range of values. Another way that LASI addresses some of the missingness in financial variables is through the use of altogether questions. So here's an example of an altogether question. Often in LASI, questions about related sets of expenditures in particular are asked as a group, for instance, in a table. So this is in the past 30 days, how much did your household spend on several different expenditure types that households spend. So communication fees, fuel, rent, tobacco products, toiletries, entertainment, and other expenses. If the respondent wasn't able to provide an exact value for each of those which they're asked, then the respondent is asked altogether what would be the best estimate of the value of the non-household expenditures. So for instance, an individual could have been able to provide a value for, of these 7, for 6 of them, and didn't know about the last one, and then they provide an altogether value. Or maybe they were only able to provide a value for the first 3, and then they said don't know to the rest, but they provide an altogether value. So that altogether value can kind of also give us a range, just like the unfolding bracket questions, within which we think the true value for each of these individual items might lie. As I mentioned, there's 2 sets of imputed financial variables included in the LASI data. This means that the original unedited financial variables that were collected as part of LASI are not provided as part of the LASI public use data. Instead, we have a set that's constructed by IIPS that includes cleaned, edited, and imputed values, and a set that's constructed by USC, which includes cleaned and imputed values. And the imputation processes employed by IIPS and USC are significantly different and reflect their different motivations and procedures. And as we mentioned, different imputation procedures are going to result in different values. The IIPS imputation process focuses on cleaning and editing values that seem to be reported or recorded in error, and imputing those using external sources. So the IIPS team cleaned and conducted logical imputation for financial values that were believed to be reported or imputed by error by a field investigator. So assuming that the person who was conducting the survey wrote down the wrong thing, they would identify those values and then replace them with values they believed to be true. And the IIPS team also worked to validate the values in the household income section, particularly against government data, external government data. And they edited those values to maintain the state rankings of per capita income from other sources. So they kind of assumed that the LASI income data should reflect what's already in external sources for income data that's been collected in India. And so values that kind of were outside of that, they were edited to maintain rankings with existing sources. The USC imputation processes focuses on addressing the issue of missing data and financial variables by using other information the respondent provided during the survey, and by using information of other households or individuals inside of the LASI sample. So the USC team used information from the unfolding bracket questions and the altogether value questions to assign values in the case that a respondent was not able to provide an exact value. And the USC team also used information provided by similar households to assign values. And the USC imputed financial variables are really meant to be used in the case of complete analysis. We've gone through a lot of work to make sure that there's very few missing values left in the data. USC, how we do that is we use a predictive mean matching method, also called PPM. And how that works is that all reported values are used. So values are not assumed to be reported in error. No ownership reports. So for instance, for a house, we saw people who said don't ownership. Those are treated as zero values. We then estimate a linear regression model of the inverse hyperbolic sine of this value with a small set of covariates. And the imputed value is then the reported value of the household individual with the closest predicted value, where the donor pool consisting of the households or individuals who reported a value that is consistent with any information provided in an unfolding bracket or altogether value questions by the household or individual that needs imputation. So what that means, for instance, is if we knew from our unfolding brackets that the true value lie in between 10,000 and 25,000 rupees, then we would look at similar households who also reported between 10,000 and 25,000 rupees, and we would basically try to determine who is their nearest neighbor. So what household or individual is most like this person, and then we take that value and assign it to them. USC also releases imputation flag variables. So to distinguish the origin of each value, an imputation flag variable has been created to accompany each imputation variable. And imputation flag variables are coded using the following codes. There's two sets of missing codes because in some cases, USC is not able to impute all values. So that can be a -2 or a -1. Although both uncommon, the more uncommon one is a -1, and that means that it's missing and not imputed due to missing neighbors. So what this, for instance, would mean is that let's say that a household said that their housing wealth was more than, let's say, let's pick a number, 500,000 rupees. And then we look at other households who are similar to them, and we don't see any other household that reported more than 500,000 rupees for the cost of, or for the value of their house. So in that case, we say we can't really provide an estimate of what this value is, and we leave that missing. But these are very rare. The more common codes that you will see are a value of 1, which means that the person was able to give you an answer. So they said, I own a house, and they gave you the value in rupees. 2, which is an imputed value based on a closed bracket. So we know the person owned the house, and they said that it's less than X number of rupees and more than X number of rupees. A code 3 means that it's imputed based on an open bracket. So for instance, that might mean that we just know that it's more than 45,000 rupees. So that's the donor pool that we use. The 5th case assumes that we know that the household owns the value, but we don't have bracket information. So the household wasn't able to provide any bracket information. And in that case, it's done without that information. A code of 6 means that the person said they don't have the asset, or they don't receive the income, or they don't spend that expenditure, and they're assigned a 0 value. And there's also some cases where we don't know ownership, and those are coded as 7 and 8. So we cannot know ownership because they said, the question was, do you own a house? And they said, I don't know. And in that case, both the ownership and the value are imputed. And we separate that by whether people even entered the module or not. So those are codes 7 and 8. So you can see that there's different levels of assumptions in these imputations. And so these imputation flag variables are really helpful for transparency. So you know exactly what level of information was used to derive that value, or whether it was just reported by the respondent themselves. For those 2 sets of imputed financial variables, they're differentiated by variable name. So the IIPS imputed variables reflect just the name of the variable as you would expect in the data. So for instance, in the consumption module, which is denoted by CO, there's questions A through J for question 2, and those will be coded as CO002A through J for the IIPS imputed variables. The USC imputed variables have those same variable names, but they're prefixed at the end of that word is to the end of each variable name is added an _I. And then the imputation flag variables we talked about have an _I_F on them. So again, for each USC imputed variable, there is a USC imputation flag letting you know how that value for each variable for each observation was derived. Here's a few more information, a few more resources to get information about LASI. So there's a LASI cohort profile, which was published in the Encyclopedia of Gerontology and Population Aging. We also have the LASI user guide. So that's going to go through kind of more in-depth information that we're including as part of this webinar, including the data structure and the imputation processes and procedures of both IIPS and USC. You can find links to both of these through the LASI website. And we also have a LASI help desk. So this is an email address where you can email us if you have any questions about getting access to the LASI data or using the LASI data. And that is help@lasiindia.org. So thank you for letting us tell you a little bit more about the LASI study. That wraps up the slides and videos that we have for today. So we'll just spend a little bit of time answering questions that people have. I see we already have a few questions that people have answered. So the first question is that I found that there are people in the LASI individual data below 45 years old. Why is that? Jin Cook, would you want to answer this question?
Sure. So we interviewed the older spouses of individuals ages 45 and older, and obviously there could be some spouses younger than age 45 and older, so they are all interviewed and included in the survey.
Great, thanks. We have a second question here, which is the imputation done only for financial variables or for other variables? So in the LASI data that's currently available, the imputation is only done for financial variables. Financial variables often have higher levels of missingness for some of those reasons that I talked about, but there can be other missing values for in other sets of variables.
So I'd like to add that we plan to also release the imputed cognition variables as well. So that would be only other module that we plan to provide imputed values.
Yes, thank you for that clarification. We have a question also from Preddy. So can you please clarify if individual level data can be used to make it nationally representative? And if so, using what weight? So I can answer this. Yes, as Hunter mentioned, that there are two sets of weights included that are individual level. And one of those is to make it nationally representative of all of India. And one of those is to make it representative inside of each state. Yeah, Hunter, is there anything you'd like to add to that?
Yeah, can you hear me?
Yes.
Okay, yeah, the second part of the question related to what weight that was. For the individual data, the variable name is India individual weight, with no spaces in between those words.
Thank you, Hunter.
Yeah.
And I see the question on when we plan to release the imputed cognition data. So definitely this year, but it's hard to nail down the exact months. Most of the work is done, but imputation process takes quite an undertaking, and our colleagues are currently just making sure there is no mistakes on any of the coding. So, but we'll definitely release it this year.
Thanks. We have Toluca, you raised your hand if you meant to, so I will unmute you if you would like to ask your question. And I think you might have just typed it, but you're welcome to ask it also.
Yeah, I just wrote the question. So should I read it or you will take it?
Sure, you can read it.
Oh, so I was wondering where you were talking about the sample selection. So you said that the sample was selected and their spouses might be under the age of 45. So I was wondering if the sample selection was specific to the gender. So like you selected male and therefore all the female, I mean, maybe females can be under 45, or the gender selection was also random. So therefore male, female both can be under 45 of age.
We selected everyone over age 45 and older, regardless of their gender. And then we interviewed everybody of the spouses of those people who are age 45 and older.
Okay, so randomly it can be male, female, anyone who is a spouse.
Everyone. There is no randomness to it. We interviewed everybody age 45 and older in the household.
But then you said spouses can be under 45, right?
Yes. So everyone, we first selected everybody who are age 45 and older, and then we sampled their spouses, regardless of their age.
Okay, got it. Thanks.
Thanks, Shukuk. Let's see, we have another question from Prati. Any updates on when the COVID-19 supplement data will be released? And this might be a question for Jungkook or Sandy.
Yeah, so we plan to again release it this year. We have a bi-monthly COVID survey. So we started back in last year, and we are about to finish our fifth wave of data collection. We have another round of data collection on COVID on next month. So after we complete our sixth round of data collection by end of April, then we have to, clean up the data and process it a little bit to release that to the public. So again, we plan to release it by the end of the year. It's hard to nail down the months. Sandy and the team will be very busy to prepare all those data.
Yes. And we have a question about the caste variable. So that says there's only SC, ST, and OBC who belongs to lower caste. How to know if the person is from upper caste? And this might, Sandy, would you be able to answer the question?
Since right now we don't release the detail of the caste information, but I think we're still in the discussion how detailed information we want to release. And then you can send in your request, and then we will, our committee will decide or have an individual to submit. We will treat it as like restrict data set, and then you might need to have your IRB ready or some other additional information in order to get that information.
Yeah, we have not decided on, how, to whom, through which policy we're gonna utilize in order to release the CAS data, because that's very sensitive and identifiable. However, our currently released data set includes scheduled CAS, scheduled tribes, OBC, and also no other caste and no caste. So there are 4 groups. So you can see upper caste people will be available from those other caste or no caste.
Thanks, Shuko and Sandy. Maybe on the same topic of identifiable data, we have a question about, are the samples geography coordinated, and is GIS data available?
So it's coordinated, but this is again restricted data because this is where exactly our respondents live. So we cannot release the data as a part of public data for sure. How we will make this sort of geographic data available for larger research community would require further work with IRB, but also other arrangement to ensure that this information does not get out to public and misused.
Thanks, Shinko. And we had one person, I think they had a faulty connection, so I can repeat this. Their question was, has harmonized data been released yet? If not, what is the timeline? So the harmonized version of the LASI data has not been released. We don't have an exact timeline currently. It will certainly be this year, I think I can say, and we are working on it now. But we don't have, for instance, an exact month to be able to provide for that. If there's any other questions, you're happy to ask them in the question and answer, or you can raise your hand and you can ask out loud.
We have a question in the chat.
Oh, yes. Do you want to read that then, Sandy?
Okay. So this person is asking, to identify the spouse, is there a spouse identifier like PN_SP in the HRS dataset? If yes, is it available in the cover screen data? So the answer is yes. There is a variable in the cover screen, I believe is CO013, I think. And then so this variable can identify which the household member is respondent spouse. And then also to simplify the process, we will provide the spouse ID in our harmonized data set. So it will be even easier. We will so in that variable, you will see which prime key, the individual identifier will be the spouse ID.
Thanks, Andy. We have maybe 2 questions that are related, which is where to get the list and descriptions of imputed variables, for example, CO104, and they say that this list is not available in the questionnaire or even data user guide. So there is in the data user guide, Sandy, you can correct me if I'm wrong, there is a list of all imputed variables, both the IPS and the USC imputed variables.
Yes, that's correct. There's a table lists all the imputed variables in the user guide.
Thank you. Manuel asks about sample code available for analysis. I think that I can say we don't have any sample code currently produced yet for analysis. Is that right?
Yeah, that's
So,
correct.
Yeah.
That's if that would be helpful, that's certainly something you could let us know. Maybe this question does let us know that, and that's something we're really interested in, providing the resources that the research community is interested in using. So maybe that's something for us to think about providing. We have another question, which is, can LASI pilot data be used with LASI Wave 1 for the states covered in the pilot? And Jin Cook, I'll let you answer that.
So of course you can use it, but it certainly is not a longitudinal data. So this is going to be two different time points of cross-sectional for those four states. So with that regard, you can certainly utilize the data for making comparisons for sure.
Thanks. And we can maybe give a little, if there's any additional questions, we're happy to answer them, or we could wrap this up. And as a reminder, the slides from today's webinar will be posted online. You can find that at the Gateway to Global Aging Data website under Documentation, Recent Presentations, and a recording of the video will also be available. And if you have any additional questions, you can also always email the help desk at help@lasi-india.org.
Okay, terrific. Thanks very much, everyone. Good luck with your research.
Yes, thank you very much.